Assalamu alaikum, I'm Dr. Mariam Atik, and today we are going to talk about a very common health problem, which is acidity, which is heartburn, and also it is called GERD, that is gastroesophageal reflux disease. So, what is it? Why does it occur? What are the common causes? And what you can do about it? This is all what we are going to talk about. So it is a feeling of burning, a burning sensation in the upper chest, behind the breastbone, and in the upper part of the stomach that occurs after eating a heavy meal, or after lying down immediately after eating, or bending over after eating, or within 2 hours of eating. If you've gone to sleep, it can sometimes wake us up from sleep. Why does it occur? This occurs because the stomach contents, the stomach acid, it backs up into the food pipe while we are doing these things. So normally it is a one-way lane in which the food that we take passes from the mouth into the esophagus, that is the food pipe, and then it goes into the stomach where it needs to be completely digested for us to gain the energy. Normally these contents do not come up, but in these cases, when the contents come up, we feel these symptoms. So what are the causes? The common causes are taking a large, heavy, oily, spicy meal. Then taking drinks such as alcohol, caffeinated drinks, too many teas, coffees, cheesy materials. This can again cause this. Then there are certain drugs such as the aspirins or the ibuprofens or sedatives or antihypertensives, which some people need to take. They can also cause this heartburn feeling. Then anything that increases the intra-abdominal pressure, such as pregnancies, such as obesity, such can, God forbid, some tumors in the abdominal area, they can all push the stomach contents up into the food pipe again. Then there is a cause, the hiatus hernia, in which the upper portion of the stomach, which normally stays underneath the diaphragm muscle, underneath a separating sheet between the chest and the abdomen, this comes up and we again get the acidic contents into the mouth and the back of the chest, that is behind the breastbone. So what do we do about it? Yes, and there is another very important cause, stress. Stress of any kind can lead to the feeling of heartburn and acidity. So what do you do about it? Of course, you have to go to the doctor, and the doctor is going to advise you certain antacids which will make your food alkaline, and if more is needed, then you will be prescribed some H2 receptor antagonists or proton pump inhibitors. But what you can do on your part is a change of lifestyle. So first of all, we have to stop eating at least 3 hours before going to bed. Then the meals that we are taking, they need to be small in quantity and more frequent ones, rather than staying hungry the whole day and taking 1 or 2 very heavy meals. Then we have to avoid the spicy, oily foods. The diet has to be well balanced, it has to be cooked properly, and it has to be chewed up properly for it to be digested and to be retained within the stomach. Then we have to avoid these caffeinated drinks and these hot teas and coffees if we are prone to acidity already, and especially not take them at the night time. We should try to include milk in our diet, but it need not be the full cream milk, because that can cause more acidity later on. It has to be low fat or skim milk if you're already suffering from it. Then taking water in the form of sips throughout the day is very, very helpful to keep this acid diluted. But we have to take care that we either drink the water 30 minutes before meals or 30 minutes after meals. No water with meals, to keep the stomach contents, the acidic contents, less in quantity. Then what else we can do? When we need to lie down, we have to elevate the head end of the bed. Either we put something underneath the head end so that the stomach contents do not come at the plane level, and we make a degree of 30 degrees angle between the head and the rest of the body. So either we put something under it or we use pillows to elevate the head. Then what else you can do? Have a proper lifestyle. Try to eat the same quantity and at the same timings during the day, which can be a very, very good controlling factor for this acidity. So take care of all these things, and if there is any stressful situation, of course we need to resolve it for the body to get relaxed mentally and to perform well. So take care of these little things and stay away from this common day-to-day problem. Thank you. Allah Hafiz.